All right, this is going to be progression 3 for the static openers that we use for lumbar radiculopathy. So for this, we're going to lie on our side, making sure that the symptomatic side is the one that's on the top. We're going to support the head so it's in a neutral position. We're going to bring the legs up to about 90 degrees at the hip. And then what we're going to do is the biggest difference between progression 2 and 3 is rather than one leg coming off, we're going to use both legs. So both legs come off, making sure that there's about like a hand's breadth of space where that leg is hanging off. We're going to let the legs relax. And what happens is when we get into this position, it opens the joints on the top side of the spine, right? And it helps to decompress the nerve roots, allows blood to flow in, and helps to relieve the symptoms on the top leg here, okay? If we need a little bit more, we can add the bolster, so I'll show you on that side, and so you can kind of see the back start to laterally flex a little bit. So we can grab that bolster. It can be, this is just a yoga mat. You can use a rolled up towel or, a pillow of some sort, but it just helps to add a little bit more side bend to provide a little bit more additional relief. So same thing, we're going to lay on our side with the bolster underneath. Okay, and so in this example, it would be the left side where I have symptoms. Head in a neutral position unless we tell you to extend for any reason. Hips at 90 degrees or above as long as it's not painful. Legs come off the table and then relax. And you should notice how there's an amount of side bending happening at the spine here that helps to open up the spaces on the top side, helps to decompress the nerve roots, helps to relieve pain in that top leg, okay? So as we say in our other videos as well, these exercises can be extremely helpful for people who are experiencing some of those symptoms down the leg, but it's extremely important that we get an exam first to rule out any other, possible underlying causes for those symptoms, and to make sure that we're giving these exercises with the proper dosage and frequency. Right? If we do it too often or not enough, or we hold it for too long, it can be really aggravating for some people. So that's why during our exams and first treatments, we find specific recommendations for our patients. So if you happen to be stumbling on the video, that's why we're not including some of the dosage for it, because we want to make sure that it's specific to the patient so that they can get the most amount of relief. So if you have any questions, feel free to drop them in the comments, and best of luck with it.